Welcome to the third video in this series, Social Accountability in Health Professional Education. My name is Mohamed Hassan Taha. I am medical educator, medical educationalist. I am passionate about enhancing the population health through advancing social accountability. In this session, I will be talking about assessing compliance of medical school with social accountability principles and values. So, why institutions are assessed for social accountability? As we discussed in the previous two videos, medical schools shape the future of health workforce. And society expects medical schools to respond to priority health needs, to reduce inequalities, to strengthen the health system, and to improve population outcome. And institution compliance answer one question: is this school is delivering on its social mandate or no? This is a very important question that need to be answered with the compliance. So what compliance mean in practice? For social accountability, compliance is not intention, it is evidence. And an institution is compliant when it can show that alignment between the mission and action. It is not enough to mention that we are socially accountable. No, action should prove this. Alignment between the curriculum and the population need. Alignment between the graduate and workforce demand. Are we responding to the workforce demand? Because there is a need and demand between the school and the healthcare system. An alignment between research and local health priorities. So, these are very important papers. I really encourage you to read it. There is evolving relationship between the medical school and health system. And this relationship could be visualized at 5 levels, from autonomy till obligation. And obligation is the highest level. And the obligation defines social accountability, actually. And this relationship based on what is shared by the medical school and health system. There is urgency for social impact in health professional education. We can see the same image in same area, in same country. We can see this very nice lecture room, simulation labs, virtual reality, but at the same time we are unfortunately seeing the same picture. So what good is to treat illness and send patient back to the conditions that made them sick? So what is good with this? Again, the responsibility of the improving the population health, although it is not entirely the responsibility of the medical schools, but at least the medical school and health science school, they should contribute with the stakeholder in improving the population health. And we discussed previously in the last video, we have 3 levels of social obligation: social responsibility, social responsiveness, and social accountability. In social accountability, the aim is to produce health system change agent. And this actually creates demand. The medical school need to work close with the health system, community, and other partners. And why measuring this compliance is essential? Measuring compliance is essential with the social accountability principles and values, because without measurement, accountability cannot exist. And measurement allow us for verification: are we doing the right things in the right way? For the comparison between the others, for the improvement, and to gain external trust from the community that we are here because of you. So social accountability must be demonstrated in everything, in every day-to-day, in everyday activity in our life in medical schools. And the core values of social accountability: relevance, quality, equity, and cost effectiveness. It should guide the assessment. For relevancy, does education address priority health needs? For quality, does it meet professional and educational standards? And the standards here need to be revisited to meet the society need. And for the equity, does it reduce disparities is education available for everyone from underserved population, from different uh, parts of the country? For cost effectiveness, does this school is used resource responsibly? And also this apply to the social accountability when we talk about service delivery. So all tools, framework of social accountability are built on these values with some orientation and some difference. Let me start with the first one is the WHO Social Accountability Grid. The WHO Social Accountability Grid connect what medical schools do in research, education, and service with what society expects for relevancy, quality, equity, and cost effectiveness. And the grid actually is a mapping framework, not a scoring framework. It's mapping for what school is doing and what community is expected, what school is doing in the research, education, and service, and what the community expects in terms of relevance, values, and equity and cost effective. And this table is demonstrate this social accountability grid. Here you see the values, and here you see the domain of any institution, education, research, and service. And this domain is detailed at the level of the planning, doing, impacting. For education and for research, planning, doing, impacting, and for service, planning, doing, and impacting. You can read two published articles that use this framework. We managed to publish the first article at the top and left, commitment toward being toward a better future of medical school or medical education in Saudi Arabia, the effort of the College of Medicine at Qasim University to become social accountable, and we use WHO social accountability grid in the document analysis as well as interviews, key informant interview. The second is a very important study conducted at the Jazeera University, assessing the social accountability of the Faculty of Medicine, University of Jazeera. Also, they have used this grid. So, when you read this study, then it will be very easy to understand this this framework, social accountability grid or WHO framework. The second framework is the CBU model. And CBU, C for conceptualization, B for production, and U for usability. And this has been work over the time. And for conceptualization, it's basically how priorities are identified and translated into strategies of the school. And for production, how education and research output are created. And for usability, how output are used by the society and by the health system. And the compliance here requires strengthening all these domains. You can read this article, which is nicely written by our colleague from Suez Canal. Is our medical school social accountable? The case of Faculty of Medicine, Suez Canal, and they have used the CBU model. Recently, the Network Toward Unity for Health, in 2020, they developed ISAT tool. And this is used for internal learning and improvement. And the purpose here is to help institutions examine their social accountability, maturity, identifying the strengths and gaps, and plan structure improvement. And the ISAT is formative, it's not disciplinary, it's not accreditation instrument. And it's available online. And the ISAT is about the core components of ISAT, including the assessment, faculty recruitment, development, the content of the curriculum, curriculum learning methods, and curriculum types, allocation, interprofessional education, community-based education, the governance, stakeholder partnership and engagement, institutional outcome, and the societal impact, and other related. Also, the NET framework, which is basically, it helps you to examine what needs are we addressing, how do we work, what do we do, and what is the difference we make. And it's actually promote partnership-based education, community engagement, peer learning between institutions, and its approach emphasize collaborations over competitions and learning over inspection. Amy developed Aspire Award for Excellence and also available online for any medical schools that want to receive this award. They have to apply, and then they have to use this criteria. And the focus here to provide strong evidence, longitudinal commitment, and demonstrating impact on the community. And Aspire is used for benchmarking, external validation, and strengthening the institutional narrative in social council. Let's bring this tool together and the framework. WHO grid define the values, CBU model explain the pathway from intent to impact, ISAT supports self-assessment and improvement, Aspire is a benchmark for excellence, and together they form one coherent compliance system. So what are the evidence required for the compliance? Typical evidence include mission and strategy documents, curriculum maps showing the community integration, graduate deployment data, research alignment with health priorities, service partnership agreement, community and health system feedback. And be in mind that compliance depends on documentation. Upon review of many medical schools and health sciences schools, some common gaps exist in this medical school. Include weak stakeholder involvement, curricular disconnect from the surface reality, research driven by funding, not the need of the community, no tracking of graduate outcomes, no feedback from the community, and identifying this gap is the first step for improvement actually. I'd like to ask you please to reflect following watching this video. Is your institution accountable by design or by chance? Who benefit most from your curriculum? And what evidence would convince a community partner that you are here because of them and you are supporting them? The take-home message here, institutional compliance is not about labels. It's not about what is available in the website, the vision, and so on. It's about responsibility, transparency, and it's about societal trust. And medical school must be answerable to the society they serve. Thank you so much for watching this video. And now we will go from compliance at institutional level to the curriculum level. And the next video will be about instilling social accountability in medical curriculum.